right? Malaria is uncommon in Mexico. Dengue fever is one of the most common things you'll see in a sick, returned febrile traveler. If you learn anything from this lecture, somebody comes back from a low or impoverished nation with a fever, malaise, headache, a little bit of rash, maybe some mild neutropenia, dengue fever. You can see in Central and South America predominant. There's also areas throughout Africa and Asia, Indian subcontinent, all the way through Indonesia and parts of Australia. It's a mosquito-driven disease. It's a RNA flavivirus, if you're interested in that. It's based on the bite of a mosquito. The World Health Organization estimates there's about 50 million cases of dengue every year. Infection rates are, among febrile travelers returning, is around 3 to 8%. Somebody comes back with febrile illness after recently traveling in the tropics or one of these areas, you're probably doing a dengue. Headache, retro pain, muscle aches, we touched on that. The one thing you need to be concerned about, and this gentleman actually got admitted because I was concerned that he was going to develop dengue shock syndrome. It's hard to predict what's going to happen. Some people will have these symptoms and get better. Some people will actually progress to having hypertension, narrow pulse pressure, and go into frank shock, and they need to be supported aggressively with IV fluids. Turned out by the next day I saw him, he was perfectly fine. Serologic testing, IgM is one way to do it. The problem is if you do it within the first 5 days, it may turn out to be negative. That was his case. I wanted him to come back for a follow-up. He didn't. I still suspect that he had dengue if anything else. Supportive care, anybody who comes in who has dengue, anybody who has dengue who develops abrupt change from fever to hypothermia, abdominal pain, persistent vomiting, bleeding, altered mental status, really have to get concerned about dengue shock syndrome or dengue hemorrhagic fever. Okay. When you get bitten by mosquitoes that cause things like dengue fever, it's usually going to be in the early morning. That's when the mosquitoes are out. They don't like to be out in the midday when it's hot. So that's a good piece of advice. Being out in the midday area is probably the safest time for mosquito bites. It's the highest risk for sunstroke. Several hours after daybreak, late afternoon, what can you use to get rid of it? You can buy DEET, where DEET, put your sunscreen on first, then put on the DEET, because if you put on the sunscreen first, if you put on the DEET first, the sunscreen may not be as effective. Okay.